In New York, there are well over 200,000 people who have insurance under what's called Health Republic, one of these healthcare co-ops. Suddenly, last Friday, to the shock of many, even people working within the system, they were told that this healthcare co-op will close by the end of the month. That's November. That's before you can even get coverage in this open enrollment period. The next time is January 1st. So they have to sign up twice right now to fill the gap to the end of December. And then because of IT issues, they can't just sign up now and get that insurance from now on in another company. They have to sign up now till the end of December and sign up within the open enrollment period like a day later for getting insurance in January. Over 200,000 people are out of insurance.
Yes.
Just in New York alone.
Just in New York, and 10 of the 23 co-ops have closed, and several more are expected to close soon. These nonprofit co-ops, many of us felt they were never going to be viable. These tiny insurance co-ops was like the Pee Wee football going against the NFL. They just didn't have the size to make it in the marketplace. But also, they weren't cheaters. And the way the health insurance market works is good guys finish last and cheaters win. The way you make a killing in the health insurance market is by signing up lots of healthy people, collecting as high premiums as possible, and giving them as little care as possible. And if they get sick, figuring out ways to force them out of insurance. That's the way the U.S. insurance market works. And these small nonprofit co-ops were not very good at playing the game. Many of them didn't want to play that game, so we're not surprised they went under. You know, the only way to insure a population that has worked is through some form of nonprofit national health insurance. That's what every other developed nation uses. And then you have everybody in what we call the same risk pool, everyone in, nobody out.
We'll talk about single payer in a moment, but Wendell Potter, can you go back to when the Affordable Care Act was being debated and what was promised and what you said at the time? Now, you worked in several insurance companies. You worked, for Aetna? You were a top executive, and as well as?
Humana and Cigna.
Mm-hmm. So Humana, Cigna, Aetna. Talk about what you were saying then. You were a whistleblower back in 2009.
Yeah, what I saw was that as you may remember, the public option was being proposed and had quite a bit of support in Congress. But over in the Senate Finance Committee in particular, Max Baucus, who was chairing the committee at the time, put together what came to be called the Gang of Six, 3 Republicans and 3 Democrats that he handpicked. He chaired this little group with the idea, the hope, that some bipartisan reform legislation could be crafted and passed. It was a fool's errand from the beginning, obviously, but out of that, Senator Kent Conrad, a Democrat of North Dakota, proposed that instead of the public option, Congress should authorize funding to create these co-ops. And I wrote at the time that it would be great if that could, if we had a world in which those co-ops could succeed. But it was just sheer folly to think and fantasy to think that could actually happen. And it's because of largely what Steffi said. They would have to compete with these very, very large for-profit insurance companies like the ones that I used to work for. I know what the barriers to entry in any market in this country, what those barriers are. They're very, very high. And unless you have incredible capitalization, they're just not going to succeed. I testified before a Senate panel, a congressional panel, just a few weeks after that if Congress passed legislation without a public option, that they might as well call what they ultimately passed the Health Insurance Profit Protection and Enhancement Act. And, Amy, that's exactly what has happened. Since the Affordable Care Act went into effect, the for-profit insurance companies have thrived. Their stock prices more than tripled and in some cases quadrupled, while the co-ops have been starved of funding, have not been able to overcome those barriers. And as we know, many of them are closing and leaving a lot of people in the lurch.
Julia Hutchins, you are the CEO of the Colorado Health App. Tell us how many people you served, when you were established, and what happened in the last period.
Well, we were established through this program, the co-op program under the Affordable Care Act, and we still today serve 80,000 Coloradans through the end of the year.
So tell us what happened.
It was a story, and maybe it's an old story of politics and fear. Certainly the program, part of a bipartisan compromise, and maybe one of the only programs in the Affordable Care Act that really addressed competition and the need to make health insurance affordable for people. We talk a lot about access to care, but access to care is so connected to cost. So we were a program from the beginning. If the rules had stayed the same, which they never do, we'd still be here. But through continued cuts by Congress, and then really at the end, I mean, where was Obama? Where is Obama now? At a time when the big insurance companies are getting bigger, what this country needs is solutions that keep healthcare local and that really engage people in their own healthcare and provide options for personalized care. And the co-op program is still around, and really, while it lost, or was politically orphaned in the process, it still is a strong foundation to build from.
So what do people do? How do you get in touch with them to tell them that their health insurance has ended? Is it possible they'll miss it?
It is, and we've done everything we can. We've been very, very vocal, and even before we closed, all our members were up in arms. We had over 500 people write to Congress in one day, and have been doing everything we can to make sure people know. We do worry about, as it gets closer to the end of the year, that there are people who are in the hospital or in treatment programs, and that they're focused on their health and not their health insurance. And a lot of our efforts as we close out the year are making sure we find those people and help them transition to something else and help them keep coverage. I mean, that was one of the beautiful things about the co-op program, regardless of where we sit today, is that we were the ones hitting the streets and talking about the value of coverage and getting people insured. And in some ways, we were a very cheap way to be able to do that.